All right, so we're going to do a knee exam. To start the knee exam, there's a couple things we don't want to forget, so we do them, front load them at the beginning. One, you can see he's already got his shoes off. You want to look at the feet. The reason I do that is for patellofemoral syndrome, I'm thinking about the feet, whether they have a high or low arch, whether they've got a good VMO, vastus medialis obliquus, whether they've got a tight IT band, whether they've got tight hamstrings. I still think about patellar retinaculum, medial and lateral. It's kind of gone by the wayside. The most important thing is gluteal strength, and I'll show you a test for gluteus minimus and medius. But to start with, we're going to do a Trendelenburg test. So we'll have him stand with one leg up, and then you're just looking to see if his hip, whether it drops down on that side. If he comes up a little bit, that tells you that his glutes are firing on this side, and that's a positive or a negative Trendelenburg. Go ahead and drop it, and then let's go ahead and stand on the right leg. Flex the knee 30 degrees. And then twist. And this one is a meniscal test. You're basically doing a standing McMurray. Same thing, duck walk. We want to squat down like this and have him take a few steps forward, walking. Good. And I consider it a positive test if the patient says, no way, I'm not getting down into a squat, or I'm not going to do the Thessaly. The other one that I like to demonstrate for the patient right here so I don't forget it is called the Thomas test. And whichever side you're looking at, say we're looking at this side, you grab the opposite leg and come back like this and just let the leg dangle. And I'll kind of show what we're looking at when we do that. Go ahead and do that for us. So let's look left knee. Yeah, I'm going to look at this one. So he pulls the leg up, and then you're looking to see if his hip flexors are tight. He'd be up like that. His quad's tight, arms or legs extended out like that. And then if his IT band's tight, it'll kind of come out to the side like that. So it's a 3-part flexibility test. You can come up. And those are the kind of ones that sometimes don't fit in. You want to make sure you don't forget them. So then I'll have him... well, first I'm looking at his arch, looking for pes planus or pes cavus. Come up on your toes. If the posterior tib's functioning, you'll create a nice arch, and then come back down on your heels and lift your toes up. Perineal's firing to do that, and then have a seat. I'll do it's easier here, so I'll do the left leg. Here, all I'm looking at is a kind of a gestalt on how tight his hamstring is by pulling his leg out, and I'm watching to see if his kneecap kind of comes out, what we call a positive J sign. If it tracks nicely in the median, that means he's probably got good vastus medialis obliquus, doesn't have too much tightness, and things are working the way they're supposed to. You can feel for crepitus and document that, but it's not really that relevant, but that's about all I do there. And then I have him lay back. And then kind of focus on first the patellofemoral stuff. So I'm going to kind of milk fluid from the joint and see if he's got an effusion. You're looking side to side to see if there's an effusion, and then if they do have fluid, you'll feel what we call bilateral patella, where you can feel the click as you push the fluid out of the way and the patella hits the femoral condyles. But then I'm going to push side to side, see if he's got a tight lateral and medial retinaculum. Palpate under the medial facet, lateral facet, and then block his quad and say, go ahead and fire quad, and see if that causes pain. If he's got chondromalacia or issues with the back of the patella, sometimes that'll cause pain. So that's the gist of it with the palpation of the patella. And then I come up, and what I want to do is a quick bounce home. So I just drop him from like 5 degrees to neutral, see if he can get to straight. If it hurts doing that, a lot of times that's a posterior meniscal injury. Then I'll flex him up. You should be get to about 135 degrees. Take him down and do valgus, checking the medial collateral ligament and varus stress, and you compare side to side if you have an issue. And then I take them right into about 15 degrees of flexion. I'm just trying to disengage the ACL, and then I'll do a quick little movement. You're blocking with this, and then pulling forward and seeing if the ACL is intact. You grade it as a 1 to 2, A or B. 1A meaning that there's less than 5 millimeters of travel and a good endpoint. A 2B would mean more than 5 millimeters of travel and B, bad endpoint. But then you can do an anterior drawer. I don't even really do it anymore because the Lockman's more important. But just push them like that, bring the other knee up, compare side to side, posterior drawer. You're looking to see if this knee drops or the tibia drops in comparison to the other for a PCL injury. And then while they're here, I'm going to do joint line palpation and palpation around the knee. You can sometimes feel a medial plica on this side of the patellar tendon. He's got that. You'll feel like a little, I don't know, it's a thickening of the synovium of the joint right there, and that can cause knee pain. Palpate the patellar tendon along the sides, hit the insertion for patellar tendinopathy, or tendinitis rather, and then I'm going to palpate medial. Looking at him as I do it, feel his medial collateral ligament, palpate posterior to that, lateral collateral ligament, and posterior to that, feel for a Baker's cyst in the back of the knee. And that's about that. And then I come up and I take a popliteal angle, expect 70 to 80 for men, 80 to 90 for women. He's pretty tight, so that can contribute to to back pain. And then I put my fingers on either side of the patella. And you don't want to do your McMurray with the leg at 90 degrees because we know he can't fully extend out. So I take him down a little bit, and then I do valgus and varus stress. And you're trying to compress the meniscus, and if he has pain and you feel a click, that's positive. I'll then have him lay on the other side, and I'm going to do an over test. I like to take the leg forward and then bring it out like that, and you're trying to get the tensor fascia lata down to IT band, straight across the greater trochanter of the femur. Palpate there, see if that causes pain. You're looking at this leg. If he's tight, he'll be up like that. He's not loose, but he doesn't have a really tight IT band. And then for runners, they'll have pain over the lateral femoral condyle where it crosses over the IT band, crosses over the femoral condyle. So you just put your thumb over there, and that's Noble's compression test. And then finally, lift the leg up, hold it there, don't only push down, checking glute medius strength, and then rotate the leg out, glute minimus strength. And you want to remember to do that because with patellofemoral, that's probably the number one thing you want to focus on is working on their pelvic and abductor muscles for strengthening if they're having issues. So that's the gist of it. You can sit up. Do want to give a shout out in case you post this on YouTube. Mark Hutchison has all kinds of videos out there, so if you look up his videos, he's got a lot of videos on different orthopedic exams. But that's the knee.